Good day, everyone, and welcome to this skills building seminar on infographics as a tool for knowledge translation. This seminar is brought to you jointly by the European Burden of Disease Network and the UvA section on public health monitoring and reporting. My name is Brecht de Vleeschouwer, and it's my pleasure to welcome you to this session together with my colleague Petronil Bogaert. As mentioned, the session is brought to you, amongst others, by the European Burden of Disease Network. And this network is currently a group of close to 300 people who have an interest in burden of disease, in the use of DALY's disability-adjusted life years to quantify health impact of diseases, injuries, and risk factors. And very often when we, as researchers, work with burden of disease assessments, we often ask ourselves what is the best and most effective way to translate our findings towards the end users, the policymakers that need to act upon our results. So knowledge translation plays a key role in our activities, but we also realize that there's still a lot for us to learn about the most effective ways of doing knowledge translation. So this is why we came up with the idea for a session on infographics, bringing together a group of experts on developing, interpreting, and using infographics. So as a technical platform, we aim to integrate and strengthen capacity in burden of disease assessment across Europe and beyond, with an explicit focus on knowledge translation. As mentioned, this session will be brought to you together with the UvA section on population health monitoring and reporting. So for that, I'm happy to ask Petronil to introduce herself and tell you a bit more about the UvA section.
Thank you so much, Brecht. So indeed, yes, welcome to everyone also from my part. I'm very happy to co-chair this with my colleague from Cienzano. It's really nice to have both of us here. So indeed, this workshop is about information infographs as a tool for knowledge and translation, which is really important also for our section. So I'm the president of the UvA section on public health monitoring and reporting. And we also I'm also the head of unit of the EU Health Information Systems unit at Cienzano, and I'm the coordinator of a project which is called the Population Health Information Research Infrastructure. And so in that project also we pay a lot of attention to infographs and to do knowledge translation. We work a lot also on infodemic management, and we have different workshops that work on that. And we actually have the pleasure of having some speakers here today that we collaborate with, that we have both collaborated with the section and that we are collaborating with in FIRI. So welcome, a warm welcome to all of you, and I really want to motivate you to ask questions at any time, so please make use of the Q&A, and also if you want to have discussions, use the chat, and Brecht will further introduce the session, and I will see you in a minute when we have our different speakers. Over to you, Brecht. Thank you.
Yeah, thanks a lot. Thanks. So the aim of this this session, this workshop, is to inform you, of course, about the increasing importance and relevance of infographics in the domain of knowledge translation, but also to show that these come with important challenges and pitfalls. And the main take-home message of the workshop will be that infographics shouldn't be used on their own. No, they should be embedded within a broader knowledge translation strategy. And this will be the first presentation of our session. They should also come with considerations on the interpretation and the perceptions of the users. So it's very important to try to position ourselves in the shoes of the people who will view and interpret the infographics in order to develop them in the most optimal way. So we've tried to compile a program with speakers that cover these different elements of infographics. So first of all, we will have Henk Hilderink from the National Institute for Public Health and the Environment, who will give us an introduction to infographics and how they fit within the knowledge translation framework. And Henk is a scientific advisor in public health foresight at the National Institute for Public Health and the Environment in the Netherlands. He was also the project leader of the last 2 Dutch public health foresight studies, the most recent one addressing COVID-19. So as a researcher and public health professional, he has a lot of experience in developing and using infographics. But we also wanted to bring in additional perspectives. We wanted to bring in the perspective of designers. What is the science behind developing infographics? So for that, we have invited Dr. Catherine Stone from the University of Leeds, who will talk about public health infographic design for the public, the evidence base behind infographics. And Catherine is an associate professor at the School of Design at the University of Leeds, with a research specialty in graphic design for health. She's also the author of the guidelines, 7 graphic principles of public health infographic design, which we can maybe share in the chat with you later on. So after having talked about the science behind infographics, we also want to give the floor to the end users. And for that, we have invited Heli Hatunen from Finland, and she's a ministerial advisor at the Ministry of Social Affairs and Health. And she will talk about how infographics are used or can be used in support of decision-making of well-being and health promotion. And Heli is also the Secretary General of the Advisory Board for Public Health in Finland. Okay, so I believe we have a very nice and complementary program. So without further ado, I want to give the floor to our first speaker, which is Henk Hilderink. And Henk will be presenting on infographics and how they fit within the overall knowledge translation framework. So Henk, the floor is yours.
Good morning, everybody. Brecht and Petronil, thank you very much for the invitation to give a presentation on infographics. It's going to be a presentation with some theory, but also with some examples and the insights that we have doing already what Brecht was mentioning, the public health foresight study for more than 25 years, which is more or less an input for many policy making processes. And of course, infographics play an important role. More and more, they are being used in all kinds of policy reports, but also regarding social media, they play an important role. I think you can see my presentation. I'm giving this presentation on behalf of my colleagues as well at RIVM, Cindy Deuning and Evelien van der Wilk. And first, maybe some theory. If we are looking at knowledge translation, if we look at an infographic, actually it's very often the end of a research process in data gathering, analysis, all kind of, let's say, conclusions that you draw. And then you try to put most important information together in an infographic. However, in that whole process of doing that research, you can have several aspects of knowledge translation. The arrow is indicating to the push model. That is very often the case with infographics. Then you do your research, and actually that is then being pushed to the user. You can also think of a more pull model there, where the research users actually are providing information into the research process. That's happening very often earlier. And you can have 2 more mixed models at the bottom. Then you have the exchange efforts or the integrated efforts. But as I said, the infographics are very much aiming at the push model. And Brecht was saying that the cost action project on the burden of disease, I'm leading the work package on knowledge translation. And especially if you look at burden of disease, it is a very difficult measures in general. That's something I've been working on also for more than 20 years. It is a very difficult measure, the disability adjusted life years. It's not only difficult for policymakers, that's very often thought of, but also to explain it to fellow researchers that are not very familiar with burden of disease. It involves a complex calculation of the disability adjusted life years. The Institute for Health Metrics and Evaluation is doing the global burden of disease study. And on the right, you see actually one of the the flow diagrams they made only calculating one of the components of the disability adjusted life years. So it's not the idea that you read it, but it's a very complex process, and it's very difficult to also to explain what you exactly did. So many choices have to be made, and they are behind all those calculations that might appear in the infographic with only one figure. You need a lot of data for burden of disease calculations, but also as a result, very often you have sex, age, disease-specific risk factors. The IHME is doing it for countries. You might do it over time. So how to present all those results in, let's say, a very compact and attractive infographic. Talking about, if you have that much of results, talking about the push model for burden of disease, actually, there are 4 important questions. The first one is when. So that is referring to the policy cycle. When should you bring your results into the policy cycle? And that is very often, if you want to be a gender setting or policy development oriented, you have certain moments that you want to be your infographic to be the most effective one. Second one, of course, also to be able to understand what you have been doing. Interaction with policymakers is important. And the third one, what, and then you have the data, information, knowledge, wisdom pyramid. What kind of information do you want to put into the infographic or to put into the policy process? But the most important question for today that I'm going to show you a little bit more how, what kind of products that can be data, dashboards, infographics, policy briefs, all kind of products that you can think of how to reach out to the policymakers. And of course, we all want to have visual content. We know that that is the most important thing that will retain in the minds of people. 80% of what is visualized will retain there. So we are all looking for some kind of visual content. And then it can be simple, let's say simple graphics that have to be easily understandable, but it can be also more complex in policy briefs or things like that. And it can be graphics, but also the infographics. And you have to be aware of all kind of, let's say, communication, but also miscommunication. What is the message that you want to communicate? At RIVM, we really like those infographics. We are also very, let's say, putting a lot of effort into always think of what is the main information that we want to send out to the public. These are just 3 examples that we did in the last couple of years. But now I want to also take some examples for burden of disease, because I think what Brecht was mentioning, that is maybe the most challenging thing if regarding infographics. So let's go to the first one. Actually, this is an overview of disability adjusted life years, results for the Netherlands. A nice ranking of what are the most important ones, and those get a lot of attention. However, the red arrow is indicating to infectious diseases, a very small sphere actually, and that also indicates, taking into account the last 2 years of the pandemic, that maybe this infographic is not very important or very useful to bring out the urgency of the current pandemic of infectious diseases, but it does give a nice overview of all, how the ranking of diseases is regarding the burden of disease. The Scottish Burden of Disease study did a little bit of the same, but they provided more information, also the numbers. So you can see that this is already giving more information. That is also possible. And just to, I mentioned already, the IHME is very active also with all kind of visualization tools. They have an interactive platform. And then you can not only see the ranking of the diseases like that, but you can also dive into the different components. So this is an interesting combination of a tool and an infographic, I think. They also do the ranking of certain diseases, changes over time, for example. And here you can see how the ranking changes between 1990 and 2019. So you can see here how which diseases moved up certain positions or which one moved down. However, you cannot see here how big they are. That is something that we did as well. On the left, you can see certain for the individual diseases. And here you can also see, by looking at individual diseases, you are also becoming selective regarding what kind of message do you want to display. On the left, of course, dementia is being put in the spotlight, while if you look on the ICD-10 chapters at that level, then of course your message is different, because then cancer is the leading position. Also, this one is providing a little bit more information than the IHME infographic, but it also, you should be aware of what kind of message do you want to communicate. And then a rather important one, especially for policymakers, because the ranking of diseases gives some kind of priority for the diseases, but of course policymakers want to also make some changes as well. This is one infographic that we made to link the risk factors to the underlying determinants of health. And here you can see actually that smoking on the left was one of the most important one. And actually, this is indicating also, this infographic is being used quite a lot, but very often to indicate the importance of smoking. While on the right, you can see all kind of diet-related risks, and we were not able by then, this was in 2014, to put them together, but so it brings a different picture. If we had an updated version, and that is a bit more balanced, because now we, for example, we also have clustered the risk factors according to behavior, metabolic, occupational, and environmental risks. And we were able to look at unhealthy lifestyles. And now you can see actually unhealthy lifestyles is becoming the second largest individual determinant after smoking. Smoking decreased a little bit in comparison with the previous one, because we had an updated methodology where we're able to calculate more of the total disease burden than we did before. So that's why the percentages are becoming a bit lower. Also very difficult to explain to policymakers, because they want to interpret it as that their smoking policies have been very effective. So let's see what just to some findings that based on let's say the last 25 years of doing a public health foresight studies, and also the burden of disease as part of it. Yeah, the complexity of all kind of analysis that you do, and burden of disease is just an example, I think is rather a big obstacle also to bring out clear messages to the audience. It is giving a unit of years of life lost and years lost due to disability, which if you look at the totals, they are not too easy to understand. However, if you make them easy to digest and attractive results, of course, policymakers are also willing to use them, especially if they are in line with the policy messages that they are supporting. And of course, and that's something that IHME is doing, you can think of a much more layered approach where you have also, you can see that the infographics are the top layer of the results, but also easy gateway also to look at more detailed results. Less is more, that's saying that is often being used, but less is also less, and that is already important. You have to leave out and choose a lot of things that you're not gonna show, and people might not interpret the message that you want to communicate in the same way that you had in mind. So you should also be able to test it. And the most important thing, of course, be creative and think about the user, not about your research, but about the user. What is it, what the user wants to see, and what is it also what is attractive to the user. Thank you very much. I will give the floor back to you, Brecht.
Great. Thank you so much, Henk, for that really nice presentation. And also, I think you made it very practical. So you really allowed us to see some very concrete examples of how you're doing that in the specific area of burden of disease. And I think it's very difficult to have nice infographics when the topics are quite complex, because you really need to disentangle. And you say, indeed, less is more, but less is also less. So it's finding this slight balance between, you know, not having missing out on information, but at the same time making sure that an outsider has easy access to and understandable in one eyesight on what's on there. I have some questions in the chat already, so maybe I can actually take one now and then we'll take the others at the end, or you can have a bit of a look at that while the other speakers are talking. So one of the questions is, Henk, considering that developing infographics might require technical and design knowledge, and research public health teams might miss those resources. So it requires technical and design knowledge. How can it be implemented in that low? Sorry, my screen is a little bit small, so I have to scroll out. How is it? How can it be implemented in that low resource context?
Yes, if you have, thank you for the question. If you have not too many resources, it's always difficult. However, if you're doing a research and it's not being brought out to let's say the broader audience that you are trying to reach out to, then you might think of reallocating some resources, because this, I think, is rather important. And there are two things that I want to mention. First, to start thinking about these products already from the beginning onwards. So it's not something that you do at the very end, but it also takes some thinking time as well to develop it. And the second one, yes, we are researchers and we're not designers. So keep that in mind. Everybody has a job to do, and our job is maybe research, and the designers should do the design work.
Exactly. So team up and collaborate. Great. Thank you, Henk. All right, we'll go to our next speaker. So Catherine Stone from the University of Leeds in the UK will be talking to us about public health infographic design for the public and the evidence.
Hi, thank you very much. Hopefully you can see my slides there.
Yes, go ahead, we see it.
Okay, great. So thanks, Hope, for a really fascinating talk. So hopefully much of the slides that I'll talk you through echo some of those points made earlier. So yes, I'm based at the University of Leeds, and yes, I'm a designer and researcher, so hopefully the information which I'll give you you'll find very useful. A few years ago I worked on a project with Public Health England making some guidelines to specifically help with creating public health infographics, and they're available at visualizinghealth.com, and it's been great presenting here and updating some of the literature review that those guidelines are based upon. So the structure of my short talk is really just spending a moment looking back in time, presenting more recent evidence for the strengths and the nuanced designs of infographics, and then also looking forward into the future, and particularly with reference to COVID graphics. So firstly, looking back, infographics have been obviously around for a long time, and we often forget that because they weren't called that. But if we look about 100 years ago, then we can see some precedents. We can see big charts paraded through streets in New York. We can also see in China in the 1920s, W.W. Peter performing data in front of large audiences of the general public in China. And there's just a couple of quotes from some older documents which highlight how performance played a really important role in making quite complex data more accessible to the general public. As Henk says, you know, this is complex stuff. So we need to think of ways of getting the message really clear and get the message to stick in our brains. There's another, I think, hero of public health information design who's very neglected. From 1924, Harold T. Larson published a paper which was really arguing the point that if we want the public to take responsibility and an interest in health issues, then we need to make the data really interesting to them and engaging to them. And no, the graphs that he presented in this paper are actually really, really complicated. These are exploratory diagrams that you have to read into and to make sense of them. He, for me, I think is very exciting in terms of the way he really values the presentation of information. So we can look back, but I mean, today it's quite still a complex area. The data is getting more and more complicated. And I do think there's probably not enough collaboration that's going on, as was echoed earlier. So we need to work together, designers and data analysts and health communicators, to improve the way in which we present data to the public. Here's an example of a project from Leeds City Council that has a lot of problems in it. So this infographic was meant to go viral and didn't. A design company designed it, but there are lots of design problems with this, which I don't have time to talk you through, but hopefully you'll see that there's a lot of area for improvement, particularly the use of colour, contrast, complexity, etc. So collaboration is really important. Work with good people. Just to highlight the principles, some of which I'll talk about in this presentation, are available on the website visualizinghealth.com. And they're based on really good, clear design principles which anybody can understand. And if you can use PowerPoint, you can apply some of these principles to your work. So I'll just flag that up. But just to update the literature really from those guidelines, I think it's useful to look at what researchers have found out more recently about the effectiveness of information design and infographics specifically. And what I like to do is when I'm trying to analyze the findings of research, it's nice to think about how infographics can attract attention, so people actually look at them and look inside them, how infographics can help us to get across clearer knowledge, how people can remember the graphics and the data within the graphics more clearly, and whether it can, the holy grail of holy grails, initiate behavioural change. So that's what I've done. I've just very quickly put together a few slides around that. So we know that infographics can attract attention, and particularly infographics that are low in terms of words. So you might have a very busy infographic, but you don't also want to add a lot of text around that. Try and keep the text low. In this study from 2021, they showed how, say, in social media, you're more likely to get likes, retweets, etc. If you keep the ratio of image to words sort of higher ratio of images to words. We also know that layout can make a big difference to information attention. So in a study that we did a few years ago, we were interested in the layout of infographics. And if you use a gridded structure, like the image on the left, there's a very clear scan path. So we used eye tracking to test members of the general public with how they read these graphics. The middle image, has a big image in it and has big text. So again, that had quite a standard scan path, which is what you want. So you want to know where people are going to look first, second, third. The third image is really complicated. And as you can see with the small little graphics underneath, that had loads of different scan paths. So it was actually a messy experience for users. We also know that layout can aid comprehension. In a more recent study, we can see that the zigzag pattern, which is the second one on the right, enable people to have a better understanding of the information when they compared it with the other layouts. So it's not just about an infographic or not, it's how we actually design the space, the ordering of the information, and that varies, and that will have an impact on our audience. So we need to think not just no infographics or infographic, but all of the design aspects of it can make a difference. We also know, for instance, that icon arrays perform much better than just text alone. There's a brilliant study by Zygmunt Fischer who also shows that, say, risk knowledge is really improved in terms of understanding and recall if the icon array is made from figures rather than blobs or more abstract shapes. And in this more recent study, 2018, again, they highlight the value of having icon arrays, small pictograms presented en masse. Also important for comprehension is using your audience to help you create the graphics. So co-creation, co-design, participatory design, very important. Involve your users from the outset, involve the users in the design, not just test it on them later. and you'll find then it will improve the quality of the work. Lots of work around co-design at the moment, and particularly around information, which is great for us. Infographics can also aid recall. So if you include some embellishment, that tends to improve longer term recall. But also, interestingly, a good title will also aid recall. So these studies kind of conflict, and often you get that. And that's not a problem. I'm just highlighting the fact that it's important to think both about image and text to get people to keep that message in their mind. Behavioural change, tricky to also to show. I'll probably skip that slide just because of timing. But behavioural change, when you try to look at in the literature for whether an infographic can change behaviour, it's very difficult to identify. As we've already heard, you know, multimodal, multi-component campaigns are better than a single one, and that's probably why academics don't go very near can a single infographic change behaviour. So that for me is the big gap in research, and that would be the exciting area to try and fill. Just looking forward to wrap up, going back to the Brinton example from New York and COVID, and sort of fast forwarding to COVID. We do need to think about how our graphics are performed, and increasingly, particularly during COVID, many of these graphs and charts were spoken about, particularly say in the UK and here in the US. There was the speculative curve, flattening the curve, was a very powerful piece of very simple information design. Keep the text low. It was all about the graphic, but it needed to be performed as well. So that, try and think about the story that your graphic is telling you. Another interesting example, if W.W. Peters in 1920 had a lot of movement on that stage, do consider the role of motion graphics. I know it's expensive, but say in this example here from Stanford University, they managed to get 1.9 million sharing this really effective and quite simple animation about how COVID is spread. So there, I think we need to up our game, not just thinking about some standard graphs, but also other ways in which we can engage the audience. Also, we need to think about how we present our graphs. So trying to pay attention to restricted colour schemes, making them feel alive. Information is Beautiful created the UK-based dashboards, which had, you know, obviously high hit rate. At one point, you know, 2 million times they were shared on Facebook. So this managed to get the public's attention and interest, and I think brilliantly highlighted Jacques Bertin's idea that a good visualization should show a single leaf, a bigger branch, and the whole tree, so that the story of COVID, for instance, was coming across very clearly. It was also, it felt alive also with the transitions between the graphics, and it was interactive, so people could explore the data. So I think there's many ways now in which we can build on the work from 100 years ago and really learn from that, learn about performance. But in summary, there's a good evidence base that infographics really do help aid retention, aid attention, and recall. So there's a lot of good work out there, and we can still obviously do more research and find out more knowledge on that front. So I'd also just like to flag up again, collaboration is vital. If anybody's interested in working with us at Leeds, or more information about the guidelines or challenging them even, then please feel free to get in touch, and thanks for your attention.
Thank you so much, Catherine, for giving us that really grounded in science and in a bit of the research, what comes all out of that. I actually have a really interesting question in the chat, which just came up. Let me try to find it again. Oh, here. Catherine, what is your take on animated infographics, short clips that are easily shared on social media, but that in the end give the same info as a static infograph?
Yeah, I think if they're done well and they're kept short, and the text and the audio echo the the images that are appearing, then I think they can be really effective. There's not a lot of research out there. We did a bit at Leeds around motion graphics and risk, and the motion graphics did perform well, but I think there is more work to be done. But yeah, I would say if you want something to go viral, it's much more likely to do that if you have that motion element.
Thank you, Catherine. And that links in, actually, I probably should move to the next speaker, but I have this question I also want to ask, like, is there any research on how infographs have actually been influenced now with social media and like this whole new way of communicating and mass communication? Has that had any impact on how infographs have evolved?
I think so. I mean, obviously they have to work in a very small space. So I think in the early days of infographic design, the trend was to multi-panels. So there was a lot of data condensed onto one page, whereas now it is a case of just a tiny box and you've got to get your message across. So I'm sure it has shaped it. And as I say, you know, in that first piece of work that I referenced around attention studies, the academics are starting to look at social media and going, does an infographic make a difference? And that generally the sort of view is yes.
Great. Okay. Thank you so much, Catherine. You already have congratulations in the chat. And I see also some of the questions have been taken in the chat on, for example, what kind of tools exist. So don't hesitate to put more in the chat as well. And keep posting your questions in the Q&A, and I will take them and forward them to our speakers. But let's go to our last speaker. It's really my pleasure to introduce Heli Hatonen. She's a ministerial, she works as the ministerial advisor at Ministry of Social Affairs and Health in Finland. And she will be talking to us about infographics in support of decision-making and well-being and health promotion. Thank you so much, Heli. The floor is yours.
Thank you, this possibility to join this very interesting session. And actually, it was very, very interesting to hear those presentations before mine, because I have a kind of a user perspective on this topic. And I'll give you some examples that of my examples that how we have used and what are the benefits and also the challenges of the infographs when they are used as a kind of to support the information needs to decision makers in the at the national level mainly. Some background issues here may be very well known already, and actually today also in plenary session we heard about a lot of this these topics. So as we all know quite well, evidence and informed-based decision making is a still challenge. It has been a long discussion around them, but still we need to emphasize that the decision makers need to have a relevant and information what they can use. However, we all know that complex phenomena in the society challenge this, and we heard about, for example, examples about the burden of disease. It's very difficult to explain to decision makers very shortly and in a transparent way. And also the growth of and availability and the quantity of information is a quite a challenge, because new information is coming all the time, and it's also confusing to people that and especially what we heard about today also because the media is reporting kind of information. It's difficult to understand actually the situation many times. And also we live in an era of the mis and disinformation, as we heard today, and this COVID situation has raised it up very clearly. That so these are the challenges we are facing every day in our work. And we all also know, and we very well know that increasing the amount of information, it's not the solution anymore. So what we need is kind of new kind of thinking. Okay, we heard that infographics are not actually very new kind of thinking, but anyway, we need new kind of tools and thinking that how we can provide the information to the decision makers and so that they they are well informed. And in Finland also we have a government resolution on promoting of well-being, health and safety to 2030, and one priority there is to improve the effectiveness of the decision making, and one part of that is also the improve the methods and tools how we can provide the information to the decision makers. So now I give you some examples. I don't know, I was listening to the Catherine's presentation. I don't know if these are good or bad examples, but anyway, they are examples what we have used, and I also get some very good ideas to go further with this. And as I say that I am not a designer, I'm a civil servant, so I have to be some I have some critics to also to those our infographics. But before that, I also want to give some examples that what kind of questions we need to respond. For example, what kind of questions decision makers give us to answer, and we have only very quick and short and brief answers to them. And for example, the information is needed to understand the current state. What is the current state in our society right now in some question? And also, what are the objectives? What are the goals? Where should we go? And also, we should have some kind of agreements on the measures, what we should do. And maybe not so much discussed, but also we have to assess the impact of the decisions, especially when we are at the end of the kind of the political circle, when we are very near the next elections. So that's time also when decision makers want to have the data that what have been the impacts of the decisions. So these are the big questions we face very often, and for example, very for us very easy questions. What is the health promotion in practice, and also what is the more difficult one? What is the cost effective way to promote the health and well-being? So what we have used. Unfortunately, there are some parts of this infograph are in Finnish, and this is the one challenge. It's very difficult to make the changes on them because there's a lot of text we cannot modify in basic tools. But anyway, this slide, it might seem it's a very useful when we need to explain, especially when we have a new decision makers. They ask, what is this health promotion about? What is it? Is it only for individuals or what it is? And this is the very useful to explain them the cross-sectional collaboration, that why we need different sectors and why we need different actors, and why it is not enough that we concentrate, for example, individuals. So we need the communities, we need to think about the whole population, and actually we need to think about the environment, and as well here we need to also understand that there are kind of mega trends like climate and culture and technology and so on. So this is very useful for that purpose. So to explain very clearly and very shortly that what is health promotion about, so that decision makers don't kind of get the right idea that it's a very wide and long term and planned work. And this is about the equity, and the same thing. I tried to translate some tips to you. So this is about differences between different population group in health and well-being, and this is also a very challenging issue to explain because it's there's a lot of different kind of differences and it's very difficult to explain that what is the main problem. So here are some examples. We have raised the child poverty. Every fourth in every fourth family there's a poverty in childs who live in poverty, and life expectancy in between genders, and also quality of life, the difference between genders and educational groups. So these kind of infographs where is kind of lot of your data, and also short explanations seems to be quite useful. And here in the left side, here is also some very short examples that what are the main things we need to do. Unfortunately, they are in this picture only in Finnish. But anyway, the point is what I want to raise is that we need very clear. We need the numbers. Decision makers want the numbers, and also graphs to make it very easily to understand what it is about. And actually, this is the one infograph from our Prime Minister's office, and my colleague said that she's not sure that if this is infograph or not, because we were discussing about this topic when I prepared my presentation, and because here is a kind of picture and here's a text, but actually there is no data. There's a lot of data behind of this, but you cannot see the data in the picture. So is this more about the picture with the text, or is this infograph? But anyway, this is the most important thing is that the office wanted to rise up that what is how we manage in the international context in the social justice. So I also happy to hear your opinions about that. And the last one, I try to be very quick, is about what we should do, what kind of framework we should choose if we want to reduce the inequality in Finland. So the aim was to describe that we need different kind of actions. We need kind of securing actions, and also we need the saving actions, and also returning and enhancing actions between them. So this was the idea to show that only, for example, saving actions are not enough. So we need these different kind of things to keep our society as equal for all people. So shortly conclusions. As you see, the infographs have become more common. We know that very well. The greatest benefits, I think, is that we can raise the we can have a discussion and raise complex phenomena to the discussion, and also we can very briefly describe the situation if it's needed. But however, I want to say that we still need the very traditional reports and research results to understand those things deeply or better. And also, yes, and what I want to say that what is needed, for example, in my work is needed the dialogue. The infographs are a very good tool, but we need dialogue with the decision makers all the time to make them to make the deeper understanding about the phenomena we are discussing. Thank you very much.
Thank you so much, Heli. I was wondering, so when you are producing these specific infographics for policymakers, policymakers have very little time. Usually they only have a few minutes. So when you need to talk to them about a topic, an infograph can maybe be very useful because you really highlight important information to them. And also it summarizes a lot of things together in one page. But I was wondering, have you evaluated actually how some of the policymakers you work with have taken up the message that you have tried to bring forward in your infographics? Or is there a way, have you maybe in an informal way, but is there a way that you received feedback and that helped you to shape your messages in the future. Thank you.
Especially the one where what I have used, for example, we had a new elections in the municipal level last spring and during the summertime and this autumn. I have been in situations where there have been new decision makers, and I noticed that, for example, that slide where I explained what is the health promotion. It has been very useful because if I don't use that, people start to discuss whatever, but if I use that, we discuss on the right topic. So this is my personal evaluation and very very limited. But whatever I have seen that if I don't know the audience and I start to talk about the health promotion, if it's very wide audience, so it's very useful to use that kind of infograph in for example in my presentation to explain what it is about. About the equity things, we don't have actually not so much knowledge yet. They are quite new ones, so we will get better on that knowledge later.
Thank you so much for sharing your insights there. Now I would invite all speakers to activate their camera, and we will have a bit of a short panel discussion based on the questions that I saw in the chat. And I think one of them is quite interesting, and I think it's very hot topic at the moment, is you can focus on some aspects in your infograph and on visualization. But this can also be used to manipulate the data and maybe convey misleading information. So I'd like to put forward to the panel, how can we find this balance and be trustful and transparent? Just maybe raise your hand a bit in your camera so that I can see who can take this question. And if not, I will just pick one of you. Henk, go ahead. I see you nod. Go for it.
Thank you. Yes, that's a good question, actually. But selecting information, what we always do with all research, actually, always has a subjective part in it. So being aware of that is the first step, I think. And yes, and it's of course up to us in all the work that we are doing to not to be manipulative. However, sending out a particular message that you want to highlight, of course, that is close to manipulation, because that's actually what you want to do. You want to highlight one of the topics, one of the messages you want to the public to focus on. So that is a bit guiding the audience towards your message. However, I think it should be important that you are transparent about it and that you are also providing the information behind the infographic, because an infographic is very often the process of a lot of work, and then you end up with one or two figures that might get a lot of attention. But you should also provide the detailed data behind it. Thank you.
Thank you, Henk. Heli or Catherine, would you like to add anything to that? Yes, Heli, go ahead.
Yes, and I think that's question also in everything, in all information you provide to the decision makers, because there are so much information available. It's always you have to choose what to bring there and try to make it very visible and transparent that what is not there and what is there. So I think the question is same in all information. Also in reports, you have to leave something out, and maybe you can write it down that we haven't considered that. But anyway, it's a very important question. Thank you.
Yeah, one of our people now in the crowd is actually making a funny remark on that. He says policymakers ask for evidence in a full report, then want it on half a page, and at some point maybe we should consider using cartoons. I thought that was a funny remark on that. So yes, there is also one other question which tries to find this balance on, should we actually simplify charts? Some studies highlight that more straightforward charts are easier and more efficient, like bar charts at top. Since users' graphic literacy might be low, should we try to simplify the most and stick to simpler charts such as bar charts, pie, and line charts? Catherine, I see you nod, so I'll forward that question to you.
Thanks. Maybe I shouldn't nod. Yes, I think there is a case for really clear presentation at certain times. I think it depends what you want people to do. So if you want them to be very efficient and quickly identify a number or a pattern, then simplicity is good. If you're wanting a a longer tail, you're wanting people to recall it for longer, or you want them to look at it, then I think we do need some other devices, and it depends who your audience is. But yes, I think there is a real issue around literacy. I think a lot of people are turned off by even a bar chart because it reminds them of maths, and they're not very good at maths. Certainly that's my experience doing research with the general public. I was shocked at how many people who I interviewed were completely turned off a simple bar chart, and indeed didn't really understand it either and couldn't tell me what it meant. So I think literacy levels are a real issue, and I think that's also why we need to look at other methods for appealing to the general public, such as motion graphics, such as very simple charts with a very clear title. The title should say what the message is, not what the chart is about. So we can do a lot with a good title that says the message. This trend is going up, not this is about trends. So I think that can help as well.
Thank you, Catherine. And I think indeed it's very important to really look at who your target message is, because really, if your message is not, tailored to your user, then the message won't come across. Henk, I saw you also raise your hand, so please go ahead.
Yes, because I think that's very good, because we should not oversimplify also the messages that we want to send out. We should be clear about the messages, but not oversimplify just because the audience is not capable only of willing to read the very simple messages, because then it has to be simpler and simpler and simpler. So what you just were saying, Petronil, actually, that we should keep the audience in mind, but also provide a balanced way of presenting information as well.
Yeah, great. Thank you. So I think there was one question which is really high up there in the Q&A, which I think Brecht answered to some point, but I also want to put it forward to the speakers, because while you're speaking, it's sometimes hard to keep an eye on all the questions that are out there. But are there any recommendations regarding online tools that you think are helpful for infographics? Yeah, Catherine, please.
Yeah, I would really recommend PictoChart, which is a really helpful tool for generating quick infographics. The issue with these online tools is whether, in terms of your data, you are allowed to put data into a website, because often, it's not data that you would want to upload to another server. In terms of pictograms, then the Noun project, Noun, is very good and has high quality pictograms, because they're very variable in quality if you go to other websites, but they tend to be good and simple and clear at the Noun project. But I would say, you can do a lot with PowerPoint. Turn the page that way. You can create guides. The shape tools are quite powerful in PowerPoint. So I often, when I've been training public health people, will say that let's just do a quick thing in PowerPoint. You don't need all the Adobe software necessarily. Still do something quite nice and clear.
That's great advice. Thank you, Catherine. And maybe if you have time, we will close the session later on, but then we can still answer some questions in the chat, so you could still read them if you want to hang on just a little bit longer. I want to keep these last 2 minutes actually and give over to Brecht, who still had a question, I think, for Henk, and wanted to show some final slides. And from my part, I would like to thank from the bottom of my heart all the speakers. I think it was very interesting and very hands-on as well, which I think is great in a session like this, and also the public health monitoring and reporting session. Still a lot of interesting sessions going on, so you can look in the program and see whatever else is coming up, and we'll look forward to seeing you in the other sessions. Over to you, Brecht. Thank you.
Yeah, thanks a lot, Petronil. So also from my side, a big thank you to our speakers and to the audience. We had a very nice interaction. And I wanted to link back to one of the conclusions of the talk of Haley, because there she mentioned that infographics shouldn't serve on their own. They should be embedded in a broader strategy with discussions, interactions with the stakeholders still being equally relevant as before. So this links us back and closes the circle of our session, because we started by introducing that infographics should be part of a wider knowledge translation strategy. And for those of you who are interested in that, I have very good news, because later today, Henk, together with his colleague Elena Palari, and both of them are working group leaders of our knowledge translation working group. So later today at 5:30 Central European Time, they will moderate a workshop on knowledge translation and burden of disease, going from the theory to the practice. So for those of you who are interested in knowledge translation as a whole, please log into that session, which I think will be extremely useful. For those of you interested in burden of disease methodologies, we will have another workshop in an hour or so, focusing on methodological choices in burden of disease studies. And tomorrow we will have another workshop on the burden of COVID-19 and how we can collaborate across countries to build capacity in performing such assessments. So with that short overview of the other sessions of our Burden of Disease Network, I want to thank you all once again. A big thanks to our speakers. Big thank you to Petronil for the very nice moderation of the Q&A session. And to all the attendees, I wish you a very nice conference and a very nice day, and hope to be in touch with you later on. So thanks everyone, and have a nice day.
Thank you, Brecht. And Leah, if you could just leave the session a little bit open so that people can still take a look at the chat, because Catherine, in the chat, I can see that people are asking if you could rephrase again these different tools you mentioned in the chat so they can take note of it. Thank you so much and have a wonderful day.
Thank you. Bye.